Hi, welcome everyone. Thank you for joining us on Friday before Memorial Day weekend. As always, I hope everyone watching us is safe and well, that you and your loved ones are doing okay during this very difficult time. I'm very pleased to have you join us today and to be joined by two friends I'll introduce in a moment, but happy to have a conversation today about the impacts of the COVID pandemic, especially in the area of mental health. We've talked a lot about how the pandemic is straining our healthcare system. We've taken a number of actions to address shortages of personal protective equipment. You may have seen articles in the paper today of how pervasive that is and how much the state's been spending on it, on ventilators, the desperately needed medical equipment, and other supplies that are making it difficult to address and get through this. But the pandemic is also having a dramatic effect on our already overstrained mental health system. This month, May, is actually it's Mental Health Awareness Month, and it's appropriate for us to have this conversation at any time in the context of Mental Health Awareness Month, and something to think about all year, but especially in the midst of this crisis. So I'm very pleased and honored to be joined by two people working on the front lines of this crisis. Dr. Mary Roberson is the founder and director of the Northern Illinois Recovery Community Organization, or NIRCO, and Vicki Tello is Director of Philanthropy at Nicasa Behavioral Health Services. So welcome, thanks for joining us. I'll turn to them in just a moment here, but I wanted to share a little bit about the problems that we're seeing and some of the actions that Congress is taking. We know that during any crisis, but especially one as broad as this, the negative news, the economic stress can create severe, oftentimes, but certainly worsen mental health issues for many individuals in our community. The stress is pervasive, and people who are already struggling with dealing with their own set of issues could be facing, obviously, even greater obstacles. In particular, it's a stress on the recovery community, people who are working to get back on their feet and pull things together. So the pandemic poses challenges to people seeking mental health care, people relying on family, friends, and professionals. And so they're looking for new ways, finding new vehicles such as telemedicine. In Congress, some of the actions we've taken, as you know, we passed 3 bills in March, culminating in the CARES Act, a $1.2 trillion package, dealing with a lot of issues. But one of the big issues was mental health. In that, we provided additional funding for SAMHSA, the Substance Abuse and Mental Health Services Administration. This was money for mental support during the challenging time to support both treatment of mental health and substance abuse and offer increased outreach. This was reinforced, that was signed and passed, signed by the president, is now law. It was reinforced in the bill passed last Friday, a week ago, the HEROES Act in the House. Additional resources because we know we need to continue to invest to make sure that people have the care that they need. I'm hopeful that at some point the Senate will choose to pick this up and move it forward, but we will continue to push forward on that. In addition, last year I introduced the Opioid Workforce Act. This is a bill that would create 1,000 additional residency slots for mental health and addiction medicine students, trying to reinforce and build out our capacity to deal with what is in many ways an epidemic of its own right. I'll continue to support efforts like this, and another effort that is critically important that we need to work to push forward is the idea of mental health parity, that we should be treating mental health as what it is. It is a healthcare issue, no different than asthma or diabetes, and we need to make sure that it is getting the same support as any other healthcare issue. So a lot more needs to be done. We'll continue to work on that. I am fortunate to have many in our community as partners helping us identify what issues and look forward. None more important than the people joining us today. So I want to turn it over to them for a quick introduction. I'll start with Dr. Mary Roberson. As I mentioned, she was the founder of NIRCO, the Northern Illinois Recovery Community Organization. So Dr. Roberson, thanks so much for joining us.
Thank you, Congressman. It is definitely a pleasure and an honor to be here. As you know, NIRCO is a 501c3 non-for-profit with the mission to promote recovery support services here in Lake County. We're providing those services for individuals impacted by substance use disorder and mental health. I have been counseling and educating individuals and families in our community for the majority of my career here in Lake County, and I just count it an honor and a privilege to be here to join in this conversation regarding mental health and the impact of the COVID-19. Thank you.
Thank you. And next, Vicki Dello is the Director of Philanthropy at NACASA. It's NACASA Behavioral Health Services, an organization that's doing work literally throughout all of Lake County. Welcome and thanks for joining us, Vicki.
Thank you so much for having me. Yes, I work with NACASA Behavioral Health Services. So we have been providing behavioral health, predominantly substance abuse services, and now mental health, and also some social services throughout 9 sites in Lake County. We provide a continuum of care that includes education, prevention, early intervention, treatment, and recovery. And we provide a variety of services that range from individual to groups to family services, treating 12 and above for direct. And of course, we have a family advocacy center services in North Chicago, which treats families in the community, anyone with a child 0 to 18. And we also work with DCFS involved families as well through our wraparound services program. And in addition to that, we have a whole host of other collaborations and diversion projects, and as well with Dr. Mary's co-collaborations to look at specific subpopulations that are experiencing co-occurring substance abuse and mental health disorders.
Great, thank you, and welcome to home working. My phone rings, but my wife will answer, so I apologize for any interruptions. Let me also remind people, I'm asking some preliminary questions, but I'm sure people have questions who are watching. If you do have a question, you can leave a question in the Facebook comments, and we'll try to answer as many as we can. But my first question for both of you is, within the community, both the mental health, people dealing with mental health issues and substance abuse issues, people who are recovering, what do you see as the key issues that folks are facing and some of the key challenges that they're working to overcome?
Okay, I guess I'll start. Yeah, some of the things that NERCO has been seeing, not only since our inception, but also through my long career here in Lake County, is that people are, faced with a lot of isolation with the COVID-19. There's an increased symptoms of anxiety. We also see that people are, concerned about overusing their medication. I mean, that was an issue prior to COVID-19, but it's definitely, an ongoing issue right now. The other issue that we're seeing is people are increasing their alcohol and other drug use, which also contributes to a lot of relapse. So there's a lot of concerns about the isolation with the shelter in place and not being able to connect with the normal social support for those in recovery. We are often, addressed with what could I do to maintain my recovery? And one of the things that NERCO has been doing with our advisor is being there, virtually and things of that sort. So those are some of the things that we are seeing.
Okay, Vicki, how about with you?
So I echo all of what was just said, as well as we are seeing complications with, of course, from COVID, with food, housing, rental mortgage assistance, employment, of course. This is leading into additional issues with insurance coverage or changes or a lack thereof. And so this is also complicating the access to care and quality care, as well as moving everything technologically. There are some people that simply don't have access, and for individuals in recovery, it's extremely important because when they're isolated and they're distancing and all of that, it is great for COVID-19, but it is extremely triggering. And so we're very concerned about overdoses, use, reuse, new use, and fatalities. The other thing for us that we can't see directly over video conferencing, but we know is there and will most likely increase, is the impact that it's having on our families. Families are experiencing trauma, abuse, domestic violence. This can lead again to increased mental health concerns that are untreated and also increased use of substances.
Absolutely. And in that, because it's different, you mentioned, it's hard to see, you don't have the same ability to connect with the people you're working with. What adaptations has NACASA made in providing services, working with individuals and families during the pandemic?
So we have been extremely fortunate. Some people may say not as fortunate because it's essential but scary. But we have been able to remain open throughout the entire pandemic. All of our services have completely converted to telehealth format. So we offer both video and phone conferencing because we know, again, that some people simply just don't have the access. Our only programs that are not continuing are in-school, after-school prevention and other things that are school-based related. We see a major importance as far as converting that telehealth. I mean, in looking at some average numbers, we serve about 5,000 to 5,500 people a year. On an average, that's about 430 people a month. In 2 months, we served 1,210 people, and that's an average of about 600 a month. So we know that people need the services and they've been accessing them, which is great. But we also know that the longer that this keeps going, it's going to be harder and harder to engage them. And the stigma that's already present is going to increase and it's going to get much worse.
I want to come back to that, but first, Mary, I want to get a sense of how's your organization working on adapting?
Yeah, I'm glad you asked that because everything that Vicki is talking about, and I applaud NACASA for all the work that they're doing, it's on the treatment end of things. One of the things that a recovery community organization is focused on is the recovery support services. And we are very fortunate here in Lake County to have the only recovery community organization with NERCO. So the adaptation that we've been making, and I echo Vicki, is we are using the Zoom platform to provide all recovery support meetings. And what that basically means is individuals that's in recoveries, including their family members, can Zoom into our Something Different All Recovery meeting. And we have been really, really fortunate because we have collaborated with the restorative justice, with the Lake County Probation to provide that opportunities for vets in need. We have partnered with an organization in Highland Park in order to address that particular community too, with virtual recovery support. And that's been a big adaptation for us. In addition to that, Congressman, we offer telephonic counseling with myself. Although we have a very small team right now, I have a host of advisors that's been really on target with helping to get these things done. So Zoom platform, telephonic, one-on-one counseling with myself or in recovery support. I'm very fortunate to be a person in long-term recovery myself for the past 27 years, so I'm able to offer those services to the community.
That's fantastic. And Vicki, coming back to you, you mentioned in the past 2 months you've seen more than a 50% increase in demand for your services. And with more people at home across the nation, people are talking about the increase in domestic violence, child abuse, other things like that. How can we best work to mediate, alleviate, address, and help people in such situations?
So again, just for us, especially with our wraparound program that works with DCFS involved families, we are conducting, our telehealth visits, but it's not the same as putting your eyes on a home, on a family, on a child. And you may also have new families now that are experiencing new stressors. I can say personally, e-learning is one of the largest stressors ever when you have a young child. And so that, especially in homes that have multiple children, maybe smaller living space, those are all exacerbating circumstances. And so it's really important to support these families, provide them with education about relationships and communication and, attachment with their kids, working with their kids and understanding expectations, but also validating the fact that they are stressed and they're scared because they're losing jobs, they're losing insurance. Some of them are losing SNAP and other benefits. They don't know how they're going to feed their kids, forget e-learning for the time being. And so it's really important to not wait for them, but to really check in on them. I know not everybody has that ability, but I know that's what we're doing here. Of course, that's part of our service delivery, and we offer still in Spanish and English our parent education groups. to support them and give them a place to, talk to each other, work with each other, again, via Zoom. But it's also really important to inform them of the services. So not just us and not just NERCO, but 211 and everything else, because domestic violence is on a rise, child abuse is on a rise. And the more difficult piece about child abuse is always neglect. It's harder to spot, it's harder to prove. And now with decreased food, decreased employment, I think that there's going to be a rise on that when everybody comes back together. So there will be a domino when all of this is over.
Great. In fact, let me ask Stephen if you can put up on the screen the contact, and then I'll remind people while that's up, if we can put that up, that if you do have a question, please put it in the comments. We'll come back and answer that. But if you want to contact either of our organizations today, NERCO, Northern Illinois Recovery Community Organization, Dr. Mary Roberson, or NACASA Behavioral Health Services, today we're joined by Vicki Tello. But here's the number and website, and thank you. Dr. Roberson, let me turn back to you, because we're all in this together. Everyone's being affected by the pandemic, and as we mentioned, it's stress on everybody. But for some people who are already dealing with stress or depression or mental health issues, or trying to recover and hold things together hard in normal times, it's particularly hard now. What can friends and family do to support someone who's on the path of recovery, but experiencing the additional stress or obstacles from the pandemic?
Congressman, that's a very good question, because that's some of the things that come up on our All Recovery Support meeting. Is my family is really, watching me super hard these days. They think that I'm going to return to substance use. So one of the things that we tell family members, the things that they could do, as well as friends, is to validate the concerns of the person that's in recovery. And the other thing that we tell people to do is to encourage those in recovery to stay connected to their recovery support system. As you know, with the stay in place, all the 12-step meetings, all other types of recovery, multiple pathways have been closed down. So that's always been an avenue for people to have that interaction. So now they're sheltered in place, don't have that availability, having to do things on, virtual platforms. And as Vicki said, some people are not that adept at it or don't have the access. So we tell families and friends to always just encourage them to stay connected to their recovery support. And then also, if there is a concern about relapse, to have them to talk through that and reach out to either their counselor, their sponsor, or their mentor, so that they don't actually turn to active use of substances. We also encourage people to recognize that cravings and urges are going to come up, especially during this stressful time. And just because a person have a craving or urge to use a substance doesn't necessarily mean that they have to pick it up. We always tell people, if you don't pick it up, it won't get in you. So we encourage families and friends to have that language, to have that, upfront conversation with those in recovery.
Great, thank you. It reminds me, when I sign off on some of these chats, whether it's on Facebook or Zoom or other platforms, some of our emails that we send out, I'll say stay home, stay safe, but I often say stay strong. And it's a easy thing to say, but for a lot of people, the idea of staying strong kind of conveys, I have to do this by myself. I have to get through this. I have to power through this. And especially, and I know this from personal experience, people who are dealing with mental health challenges are reluctant to reach out and ask for that help. And sometimes the idea of the strength comes from is like saying, hey, I just need to talk to someone, or I need some assistance. And that getting over that hump and getting the next day and through the week and through this crisis. Can, as for both of you, touch on how we can help people feel confident and comfortable reaching out to your organizations or friends, family, whatever. Dr. Roberson?
Again, one of the things that NERCO is very, very pleased to be is the part of a national advocacy organization called Faces and Voices of Recovery. So with that is putting exactly that, a face and a voice to recovery. And that allows people to see people like myself or people like maybe someone in your family might be in recovery. We have to bust that stigma because a lot of times we don't want to admit that the person is in recovery. So being able to, let a person know that, hey, I've seen those same struggles, or I have a recovery advocate or a recovery coach that is available for you to kind of talk through these things. It's important, again, to reduce the stigma. We call promoting recovery versus reducing stigma, because stigmas always bring to mind that there's something bad about it. So we talk about with NERCO and our national advocacy organization, Faces and Voices of Recovery, is to promote that recovery does work. And by promoting that recovery does work, by showing a face like myself or a face like another individual who is in long-term recovery, it allows people to come forward and talk about those struggles. Hey, I'm having an urge to use. Well, you really don't have to, because, one of the things that we keep saying is, again, recovery is possible. And that treatment does work, and recovery is possible, and we have those services for individuals and families.
Thank you. And Vicki, you from your experiences, want to share?
So I again echo everything that Dr. Roberson is saying, and just a quick plug, I also have to say that thankfully to collaborations such as NERCO and other things, we are able to further support our clients and our individuals and our families, because without that collaboration, it's not possible, especially with the increased amount of need. But yeah, stigma has a very negative connotation. It doesn't mean we don't use it here, but we are always thinking about it. One way that we tried to address that was by creating what we call our HUGS line, handling uncertainty with guidance and support. It's very similar to, Call for Calm and other things of that nature. And our intent was not to duplicate services or try to gain anything. It is our free bilingual emotional health recovery support line, because we know that people are concerned about labeling themselves and putting themselves in a box. Do I have a substance problem? Do I have a mental health concern? So we put this out to the community saying it's free. You don't have to be labeled. You don't have to know if you fit a box or not. You might just need to talk to somebody, or maybe you just need to know where a food pantry is. The idea is just to get them on the phone talking to someone, Spanish or English. They call and they speak with our counselors, obviously during our business hours, not crisis line. And more often than not, we're able to connect them internally to some of our services that they didn't know that they needed, and it's been a positive for them. Sometimes they don't need something with us, and that's okay too, and we will refer them to the appropriate source. And so we have really tried to push that, especially important for people who are losing their insurance benefits and coverage, and also with the undocumented community. They face their own challenges. There's political fear, they're afraid to go out, they're already not receiving benefits aside from stimulus and other things. They have higher rates of being affected by COVID. So what does that mean? And they're not always thinking about their substance use or mental health needs. So that was a way for us to try to encourage that participation and involvement. And again, like Dr. Roberson said, just letting them know we're here, it works, we're still going to be here, we're not going to turn you away, so please call us.
Absolutely. Let me just touch real quickly, talking about undocumented. I know that we have a testing site in Waukegan. We have testing sites around the county or around the state, but there's a drive-through testing site in Waukegan, and they've been asking immigration status questions originally. We actually inquired with FEMA why that was happening, what was going on. And I'm pleased to say they are no longer asking that question. They never should have been asking that question in the first place. It's important for everyone to get tested, and I think that's critical. The other thing I'll say, just as I'm listening, I'm thinking, and you see the videos, the uplifting videos of someone who's recovered from COVID, walking out of the hospital and everybody cheering them. And there's no stigma to having gotten sick, but there's celebration of having worked and fought, and in some of these cases, fought life versus death to defeat the virus and leave. And what I'd like to imagine we can do is celebrate the people who are working on recovery in the exact same way, ensure their recovery without the stigma. That's really, I think, what we need to strive for, because there should be no stigma. Mental health, addiction, it is a disease, as I said before, like asthma, diabetes, cancer. We want you to win, and that's where I think the idea of reaching out and reaching for help. But Vicki, you also mentioned this pandemic in particular is hitting our poor communities, our minority communities harder in many different ways. It's not just a matter of, as the economy shut down, people losing their jobs, people who are struggling financially before this crisis, living in tight quarters, may not have access to the same broadband as we have here as we're talking. And we've seen the numbers, the fact that the Hispanic community is more likely to get infected with COVID, just a number of reasons, partly because they're out having to work, the African American community. So we're seeing that across the board. And so my questions again for both of you, are there things that your organizations are doing to try to help reach these communities in particular? And then personally, are there ideas or thoughts you have that ways we can help uplift these communities as well? Vicki, I'll start with you.
Okay, so again, we had our hugs line. We tried to push that pretty strong. We went throughout, Waukegan, North Chicago, that area, put up flyers in places that are still open, grocery stores, and any workplaces that would let us come and hang something up, less of those than the grocery stores, but also religious entities, also just talking with our participating providers in Lake County who have been great using social media. That doesn't reach everybody all the time, but it is one way, and just getting that message out. And we do a lot of work with those particular populations in our Family Advocacy Center, and our staff overall has been great and committed to all of our individuals and families, but there in particular, they're really kind of going above and beyond sometimes. I know a recent story we had is that people really were in need of food. They were undocumented, didn't know where to get it, how to get it. They were fearful. We had a staff that basically had a car caravan and drove them around and said, I'm with NACASA, I represent them, they need XYZ amount of food. And she was able to get, I think, 7 or 8 families on that particular day. And that's now kind of become a regular. So really just trying to get as many touch points as we can with those populations.
Great. Mary, what about you?
Yeah, thank you. One of the things that NERCO, when we founded it, was we wanted to make sure that we had a very diverse staff of advisors and board members. And right now we cover the spectrum from African American to Latinos to Europeans. And I'm very excited about that. And one of the things that we have been doing is having that robust conversation about the racial divide and the health disparity that's been, highlighted in our communities. And by having that robust discussion, not only with the advisors and the board, but also the individuals that's seeking our services. One story I could tell, I have a Latino male that I'm working with, he's very concerned about COVID-19 and he's involved in the Transform Lake County program. And he's very concerned about his learning ability with the e-learning and his family and things of that sort. So in providing recovery support services for him, I often encourage him to talk to other Latino males who are in recovery or other individuals in poor communities that may be able to help him. So one of the things that we realize is that the more we are diverse in our efforts, the more communities of colors are able to come and seek our services. I've been pretty fortunate, Congressman, in that I have been in this social service arena in Lake County for the past 25 years, and I'm well versed, with the service providers. As a matter of fact, NACASA is my parent organization as far as being a retiree from there. So being able to connect those resources for the community of colors that's experiencing that. And lastly, I would like to say with the collaboration with the Lake County Opiate Initiative, we've been talking a lot about impacting communities of colors with the Way Out program, and I am highly involved in that discussion. So we are here to be in the room. We are here to be at the table so that our voices could be heard for those communities that's being impacted. Thank you.
No, thank you. And we're all in this together, and we
Yep.
need to recognize that. And it's important. We've had conversations. In fact, next week, the Ways and Means Committee, of which I'm a member, is having a hearing. It will be our first virtual hearing in this pandemic, so it's relatively big news. And I'm very pleased that what we chose to make our first topic of a hearing is exactly this, the disparate effects it's having on different communities and what we can do to try to support. While the impacts may be different, and part of that is things that existed before this pandemic, which we have to address, as we work in getting through this and we're working applying resources, we need to put them where we need them, irrespective of anything else. We've got to lift everybody up, and we will continue to try to do that. I think that's really important. And you know, speaking of, as this is going on, I know that for you know, many people who have either lost their job, they might be furloughed and working fewer hours, or if they're working, they may be concerned that they're going to lose their job. All of those things bring with it different types of stress and anxieties. And again, no matter what situation you're in, you feel that. But if you are dealing with a mental health issue or addiction issue, it can be exacerbated. What kind of things can we do to help people with those issues? What are you hearing from the people you're working with? Dr. Roberson?
Yes. Well, the main thing that I'm hearing is I am so glad that you guys are still there. That's the main thing that I'm hearing is, you know, that people are really happy that the services are still being provided. They may not be being provided in person, but they are still so very, very grateful for the services that's being provided. We'll continue to help with virtual platforms. We'll continue to help with individuals on the phone. And when things kind of let up, we'll begin to see individuals according to the plan for the state. So that's it.
Vicki, let me take you in a slightly different direction, because you mentioned this before. You know, people who are doing homeschooling now, remote learning, you know, folks who are trying to do their own job, look for a job, cook dinner, all of those things, and then teach math that maybe they don't remember from, in my case, it would be a long, long time ago, or you know, teaching science or new subjects. Again, things that cause stress, but also stress within the family. What do we need to know about that? And again, what might we be able to do to help in these situations?
I think, again, you know, a lot of our individuals and families have said something similar to Dr. Roberson, that they're just grateful that we are still here for them. I think providing resources is an excellent thing to do, but I think people are also a little bit inundated with school resources and health tips and this and that. Really, the primary way to communicate right now is electronic communication or via the phone. And so I think going back to something a little bit more basic, which I think is harder for higher ups and policymakers to always understand, is that validation and listening and understanding that there's a human being on the other end sometimes is more supportive or helps them build a natural support. There's that old saying, it takes a village. Some people don't have the village. Some people's entire family represents a village that they need to raise. And they don't have those supports, or because of COVID, they don't have the supports. So again, I think really just listening and processing and going through that instead of always just throwing a bunch of call here, do this, do that. It's very overwhelming for people to have to reach out and make all these connections. So on our end, case management advocacy is extremely important. Contacting these individuals, letting them know what's out there for them, what's available. And I will just have to say a small plug for 211. It's new, it's fresh, but for anything that you can't do, it's there. It's in 150 plus languages. Refer your people, call for your people. People can call all day, all night. You know, some people don't want to call an emergency situation, or they really just don't know how to help their kids through e-learning. And it might not be just about math. It might be a larger issue. And there are many other resources, but 211 just happens to be in top of my head. So people don't have to think about, well, which one do I need to call? They will do the hard work for you.
Yeah, and let me share, in addition to 211, you'll see on the screen, there's a number of resources. You can text either TALK, T-A-L-K, or hablar, H-A-B-L-A-R, to 552-020 to get support from a counselor in your local area. The Lake County Health Department has a crisis line, 847-377-8088. The Illinois Domestic Violence Helpline is 877-NDV, 877-863-6338. A safe place here in our community is also offering an emergency hotline. Their number is 1-800-600-SAFE. We already mentioned 211. The National Alliance of Mental Illness, NAMI, which has chapters throughout our district and across the country, 1-800-950-6264. And finally, the National Suicide Hotline, 1-800-273-8255. And that reminds me, one of the things that was in the HEROES Act is an effort to create a 3-digit national suicide hotline, 988, and I'm hopeful that that's something we can push through. So thank you for sharing that. And as we begin to wrap up, let me again turn to my panelists, Vicki Tello and Dr. Mary Roberson. Thank you so much for being part here. Anything, last comments you want to share? Vicki, I'll start with you, and anything people need to know.
I think just kind of a closing reminder is, again, what everybody's been saying is that we are in this together. So if you're noticing something about yourself or your family or your friends or other people that you haven't seen, or anything over Zoom or whatever other video communication that you're having, now is the time to be open and hopefully honest about it, and just support one another in any way, shape, or form. Again, especially for us, you know, those in the recovery community, those who are most fragile, are undocumented individuals, things of that nature. So just be there for one another, and we are here. Call us.
Thank you. Dr. Roberson.
So again, echoing what Vicki is saying, we are here, particularly the recovery community. We are pretty fortunate here in Lake County. There is a robust recovery community, and NERCO has their finger on the pulse of that. So please feel free to contact us. We are here. I mean, it may sound cliches all the time, but we are in this together. And one of the things that we know in the recovery community is that there's therapeutic value in one person assisting the other. So we encourage you to do not let ego, easing God out, stand in the way of you contacting someone to help you in your recovery.
Thank you. I like that. Thank you, guys. And again, thank you for joining us. This has been a wonderful opportunity to talk about an issue that's important to our community. I've been very fortunate over the course of this to be able to have a number of these conversations. 2 weeks ago, we had my colleague, Lauren Underwood, representative of the 14th District. And then most recently, we did something with representation from the Latino Hispanic communities. I hope we can continue these conversations. As has been said multiple times, we're in this together. We are one community. We are stronger when we are together. I think when I say be strong, it means be strong together and help each other, reach out, and look after each other. I hope we can get to that point where we are clapping and celebrating for people in recovery who are stepping forward, standing strong. And I hope people who are struggling know that they're not alone. We're here for you. Whether it's NACASA or NERCO, thanks for what you guys are doing day in and day out. And again, to everybody, wherever you are, wishing you good health, a very nice holiday weekend. In this holiday weekend, let's keep in mind all those who made the ultimate sacrifice in defense of our nation on this Memorial Day, and all those who are in uniform here in the United States and around the world, serving us, many of them places far away, on ship or on bases, protecting us. But at this time, many people in uniform who are working within our communities helping us deal with this crisis. We owe a debt of gratitude to all of them and to all of the heroes who are fighting at this time. Our healthcare workers, people in nursing homes, people who are keeping our stores stocked, our police, firefighters. Everyone in this is a hero, and it just reemphasizes the fact that we are one community, one nation, and we will get through this together. So thanks to everyone, and thanks to my guests. Have a wonderful weekend. We'll talk to you soon.